Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Dental residency programs have blossomed over the past several years in hospitals throughout the country and in the military services. Recent graduates are participating in these programs with the hope of expanding their clinical skills and exploring the various aspects of dental practice in greater depth. Our guest is Dr. Craig Spangler, a recent graduate of the University of Michigan School of Dentistry, and Dr. Spangler is now in his last 2 months of a year-long residency program at St. Joseph Mercy Hospital in Pontiac, Michigan. Dr. Spangler, what were you looking for in a dental residency program when you decided to do that?
Well, when I was in my second and third years of dental school, I could begin to see that there was no way I was going to be able to obtain all the skills that I wanted to have under my belt before entering private practice. I saw the general dental residency as a way of increasing the breadth of procedures that I could undertake and gain clinical competence and additional confidence in the procedures that I would choose to undertake in my own private practice.
You think when you get into private practice, if you don't have a strong clinical base that you would tend to shy away from some of the challenges that would come before you in your office?
I think it's very important that in a private practice, in a general private practice, that the dentist be able to do a wide variety of procedures. In the future, I believe it's going to be very important to the private practitioner to not be referring every individual procedure out to a different specialist, but to be able to do those procedures himself, both for the financial remuneration and also for the variety and enjoyment of dentistry.
Do you think dentistry is becoming more competitive so that the general practitioner has to do more of those kinds of things?
I think in most major market areas, it's going to be essential in the future that the general dentist have a wide variety of clinical skills and to know how to handle the more difficult cases.
I'd like to back up and establish what is a dental residency.
A general dental practice residency, or internship as they used to be known, are one-year rotating programs that are available at private hospitals, Veterans Administration's hospitals, and in the military. These programs have a wide variety of clinical applications and definitely a wide variety of medical interests also. Basically, the resident has an opportunity to gain additional clinical experience in all specialties of dentistry and in rotating through services of the hospital. These could include anything from anesthesiology to treating trauma in the emergency room.
Do they do this on a full-time basis every day of the week or 7 days a week, or what is the schedule that they work on?
Most general practice residents are present 5 days a week during what would be considered normal clinic hours. However, in my residency, as in many others, there are periods of call when you are on call, either remaining in the hospital overnight or being available upon quick notice to be able to come in and treat patients as they would find it necessary for whatever particular service or emergency area you may be dealing with.
Are there any classes associated with the residency? Do you have seminars or classes or discussion groups or anything like that?
Many residencies offer different classes available. In my particular residency, we've had formal didactic training in advanced oral pathology, physical diagnosis, and other less formal discussion groups and things dealing with such as pharmacology, radiology, more advanced knowledge available to us in each of those particular areas.
I wonder if you could go through a typical day of a resident. What happens to you? What would outline the time span of the day and the types of activities?
On any particular day in the general practice residency, it could be as routine as perhaps starting in the morning at 8 o'clock and doing amalgam restorations, crown and bridge, periodontics procedures, or perhaps working on some impacted third molars, or just doing what would be constitute an average day in a dental practice. On the other hand, a day could also consist of beginning early in the morning, as early as 7 o'clock, and working on an anesthesia rotation where you would actually be doing anesthesia, general anesthesia, on patients in the operating room for procedures that may not even be related to dentistry in any way, but actually going ahead and working as a nurse anesthetist or an anesthesiologist would work. Other different types of things could include being called back in the evening as late as midnight, 1 o'clock in the morning for someone that has had an automobile accident, avulsed teeth, fractured mandibles, extremely acute dental infections leading to facial cellulitis. All these things are possible things that could occur during any particular day in a general dental residency.
During those activities, are there resource persons that you can draw from as you experience things that you may not be totally familiar with or have total confidence in yourself in doing, such as a mandibular fracture case or very difficult dental problem in terms of restorative problems? Are there people on staff that you can turn to for help and guidance?
At our particular dental residency, we have oral surgeons that are on call for any particular time. If we happen to run into a mandibular fracture, we will go ahead and do the diagnostic workup of the patient to determine what type of fracture it is, obtain the necessary x-rays, and then call the oral surgeon who will come in and assist us in treating the patient. In addition to that, we have staff people, general dentists, endodontists, periodontists, that all come into the clinic for time periods during the month, such that if we do have a particularly difficult case as far as endodontics, for example, we will be able to schedule this difficult case during the time period that this practitioner is present. This gives us a lot of insight into how the specialist who deals with these problems day in and day out handles them in his own office, and gives us quite a bit of additional experience in a relatively short period of time.
There are residency programs all over the country. As I mentioned at the outside of the program, in military service and private hospitals, you mentioned the VA. Are they all the same, and do they have to meet a certain standard? How are they set up?
General dental residencies differ quite greatly throughout the country. There are certain standards that are established by the American Dental Association, and to be accredited by the American Dental Association, they have to meet specific requirements. These include having rotations in areas of the hospital, including anesthesiology, general surgery, having adequate time in the clinic for the specialties of dentistry. So each program that is accredited meets these certain basic requirements. However, I think in looking at a lot of other dental residencies and in examining them myself when I was attempting to be selected by one of these programs, it became apparent that all of them vary quite greatly. A lot of it has to do with the personality of the director, what his particular interests are. If the director is an oral surgeon, you may find the program is fairly heavy in the area of oral surgery. If the director is a general practitioner that has an interest, say, in occlusion or full mouth rehabilitation, then you're going to find it's going to be oriented more along those lines. So it's going to vary quite a bit depending upon the people that are there and the type of program that has been established.
Are they all uniform in length? Are they all 1 year in length?
All of them are 1 year. In the past, there used to be a Veterans Administration program that lasted 2 years, but at this point in time, most are 1 year. Some are becoming 2 year. But,
how do you feel about that? Is 1 year adequate? Too much? Too little?
I feel that 1 year is very adequate. In fact, if I had to probably place the ideal length on the program, it might even be 8 months. But obviously, for administrative concerns, 1 year is, I think, is adequate both from the point of the program and from the resident's point of view.
I wonder, as a student that might be in their junior year in dental school or senior year, thinking ahead after graduation about where do I go from here, would they look at a residency program as a place where they can have a little space to decide what they wanted to do? Could it serve that function?
I think it's very useful in that respect, in that as you stated in the introduction, it is a transition. It's a year of transition. No one is going to get rich working in a general dental residency. However, I think that as a time period to sit down and kind of mull over what your goals are, examining what the future will hold for you, and finding out if any one particular area that you may work with, any one particular specialist who is in a particular area, endodontics, pedodontics, if those things appeal to you. If you find that they do, then I think it's an opportunity to really determine if that's what you want to do. And so it's
so it could lead you into a specialty area, strike your interest up in a specialty area?
I think that's one of the most important functions of the general dental residency, is that if a resident, prospective resident, is thinking about a specialty, a general dental residency can give him the opportunity to work with specialists in that area to determine, I think, more finally that this is what he wants to go into. And then it is an excellent credential as far as applying to specialty programs, especially in the area of oral surgery. Many oral surgery programs now are looking at the general dental residency as almost being a necessity for someone going into one of these programs, having the chance to have worked within the hospital, to gain some experience, and I think they find these people are more certain that this is what really interests them.
If a student that reaches the point of graduation and decides on a residency program in another state, do they have to be licensed in that other state?
It varies from program to program. There are some areas where they do require licensure. Other times they will issue a temporary license if possible. In the Veterans Administration's program, it's not necessary at all. You're practicing in a federally owned institution, and you do not have to be licensed for those particular residencies. But this is something, a question that would be an excellent question to ask of each individual program director to determine what the particular state requirements are.
Most dental students have accumulated substantial debt from dental school. The costs of dental education is rather high these days, to say the least. I wonder, as they get into a dental residency program, you indicated financial support. In this year of 79-80 that you're in, could you give us an idea of the type of stipend that is available, benefits, and so forth?
In my particular program, the salary for my position is approximately $16,000. Next year, in my program, it's going to be going up to approximately $17,500. The salary varies, as do the benefits, from program to program. An adequate range, I think, would probably include salaries between $11,000 and $12,000, all the way probably up to $18,000. Benefits can include many different kinds of things. In my particular program, we have health insurance, obviously hospitalization, dental insurance. We have all our meals free at the hospital, which is quite a good benefit, especially if you're not interested in doing those kind of things and you're on a very busy schedule. It's an excellent benefit. And other than that, we have uniform allowance. I think the benefits package is very good. I think it's comparable with most
You have some
industry
time
packages.
off during that year?
We have 3 weeks vacation in my program, and 2 weeks vacation appears to be about the standard throughout most of the residencies.
And also sick time if you're ill?
Oh, we have, I believe, 25 or 30 sick days available to us, and that's a very valid concern, considering that you are working with many people that are ill.
Do these benefits also include a spouse if one is married and children? Obviously the meals probably wouldn't,
Right.
but such things as the health insurance and so
Right.
forth.
All the general health benefits would include spouses or dependents of any sort.
We'll continue our discussion on dental residency programs and what to look for in selecting a program after this message. Our guest is Dr. Craig Spangler, a resident in a general practice program in Pontiac, Michigan. Craig, When you look at the residency program, what experiences have you had that you really feel are different from traditional experiences, and which ones would help you particularly in your future practice?
I think there have been quite a few areas that we've entered into and enlarged upon, either experiences in dental school or things that are new to the dentist that will be very beneficial to me, Joe. I think the situation is such, like, for example, with the anesthesia rotation. I know now that I have confidence in utilizing techniques of intravenous sedation. I know that if I would ever have to intubate a patient for any reason, that I could do it confidently and would be able to. We've had opportunities to manage non-dental problems with pediatric patients and gain a little bit better understanding of the kinds of treatments that are used and problems that may occur in patients that would just walk into the office for general dental treatment. I think the other extremely useful experience that we have gained in the hospital dentistry situation has been that of treating the handicapped or medically compromised patient. These people have traditionally been underserved by dentistry, and it's really only been within the past several years that their needs have begun to be addressed. The general dental resident who has had training in the operating room doing general dentistry is familiar with the general anesthetic the patient is going to be anesthetized with and how all the techniques are done, familiar with gowning, scrub technique, everything. This makes him the leader in finding care for these people. And as more and more people live longer lives, being prolonged by modern drug therapy, better health care, we're going to find there are going to be more people that are not going to be served by the traditional dental office. And it's up to people who have had experiences like this to help these people, and it can be a very, very satisfying experience to serve someone who has been shunned by the rest of the dental health care community.
Dentists have, as a group, seem to shy away from the hospital setting as a basis for treating patients. I'm talking about the very large number compared with private practices. It seems like the residency program might be a potential to start the change and use the hospital and dentistry even more.
I think that's exactly the case, because we have a situation where we work with physicians closely. The physicians know what our capabilities are. They are eager to learn from us. Frequently they have problems that extend into areas that we can give them help on. For example, the problem of TMJ dysfunction. The ear, nose, and throat people, many of them were not as aware as they should have been of people with TMJ dysfunction and the kind of problems that it can lead in their area. So I think the general dental residency is both good for the medical community, but the dentist has an opportunity to work with these people and to learn from them, to learn how to write orders in the hospital, to learn how to manage patients in the hospital, and gains from having rotations in anesthesia, from working with people in areas of general pathology, hematology, having a chance to review blood disorders and work with people in coming up with a protocol for treating people that have blood disorders or other problems like that.
You're a recent graduate now for a moment, and you're thinking about a dental practice residency. Well, let's back up even further and say that you're in your junior year and you're looking toward graduation and potential of participating in a dental practice residency. What should that student look for in selecting a program?
I think it's important that the student set goals to determine what he wants to attain out of a general practice residency. If your interest perhaps leans toward oral surgery and you might be thinking about specializing in the future in oral surgery, then you should look for programs that perhaps have an oral surgeon as director or have areas of good oral surgery experience, adequate numbers of patients, good time as far as utilizing the operating room and this kind of thing. On the other hand, if your interests lean toward other areas, general dentistry, perhaps, then I would select a program that has a director and a strong general dental staff. It is very difficult to discern many times which programs are strong in which areas. I think the key to it is talking with the current residents. They have many times, they are not tied to the program for longer than a year, and many of them will give you very frank opinions of their programs. I visited residencies where the residents told me, don't come here. And to me, when a resident says that, who's currently there, that's a red flag that tells me this maybe isn't as happy a situation as it looks. So I think that the current residents are the best resource people to utilize in determining what the program is like. They can tell you what things are currently. They can give you their opinion of what the expertise of the individual staff people are, and generally at any one particular program really give you the truest view of what the program actually is like.
How important are issues such as facilities, the patient pool, financial support for patients, and so forth? Does that have a significant impact on the quality of the program for the resident?
I think it's one of the most essential areas to look at any particular program are the questions that you have just addressed. One, for example, the financial situation in regard to the patients. I've seen programs where the patients that are basically treated in each of these general practice residencies are indigent patients. Many of them cannot afford to seek dental care elsewhere. However, if some means is not fabricated to allow these people to have adequate dental care, there's no way that you're going to be doing a full mouth rehabilitation on someone, even if it's necessary, if the laboratory work or the procedures, the gold itself, cannot be financed. So I think it's essential to look into every individual program to find out how these procedures are taken care of. And many programs have funding set up such that when good teaching cases come along that will require substantial amounts of financial capital to construct this case, then the mechanism is there for this to be undertaken. Otherwise, you end up in a very frustrating situation, I feel.
Do candidates for a residency consider the facilities as a major issue, or is it not particularly major? The hospital in general and the clinical facilities that relate to dentistry.
I think it's important that in looking at any particular hospital, the facilities are definitely important. However, I've seen some hospitals that have very beautiful facilities, up-to-date, modern equipment, but the program didn't back it up. So I think it's very important that on the surface you find some place that you'll be comfortable working. I think the other questions that should be asked are what exactly is the role of the dentist in this hospital? Are the general dental residents accepted? Are they treated as outcasts? I think you'll find that in most of the programs today they are becoming more and more accepted, but it's a good idea to find exactly what parameters of treatment the dental residents and the dental staff as a whole are allowed within the hospital structure.
What about size of the staff? How many residents are in a given program typically? Dental auxiliaries, what support that you have directly in the dental area?
General dental practice residencies can vary greatly. Programs frequently can have as few as one resident. They can get up to as many as 8 or 10. My particular program, we have 2, and that was another consideration that I looked at in choosing a program. I didn't want to be by myself somewhere where it was only where I had the whole burden of doing everything myself. But on the other hand, I felt that in a larger program it may be possible that you may get lost in the shuffle to a degree. Auxiliaries, I think, are important in determining what type of program you want to go into, and that if you are interested in practicing four-handed dentistry and have been taught in four-handed dentistry, it would be nice to have a chairside assistant available to you. And also someone, obviously, in the reception area to take care of appointing patients and this kind of thing, so you can concentrate on learning, gaining experience in doing dentistry, which is the whole goal of the general practice residency.
Let's talk about procedure for a moment in terms of how a student would go about the process of applying to a residency program.
I think the dental student, in looking at the year post-graduation, should really be thinking about general dental residencies at the end of his junior year. Many of the deadlines for application to programs are in October, November. Selections are being made for the programs as early, many of them, as November and December of the year prior to July 1, in other words, prior to the graduation of the student. So acting early, obtaining applications is very necessary that be done as soon as the person thinks that he may be interested in a residency. Applications are available from each of the individual programs. There's no central application service, and the addresses of the and names of the program directors can be obtained from the booklet from the American Dental Association listing all the programs in advanced dental training. I think that another point that is particularly important is that while you may have excellent credentials on paper and you may feel that there's no way this program can turn you down, it's very important that you actually visit the program and talk and speak with the program director, with the residents, all the things that we've talked about so far. And I think that indicates a certain amount of interest that is necessary in making yourself a viable candidate.
One very quick question. If you could look back and do it all over again, would you go into a residency program?
I think, in looking back on the year, I think it's been an extremely valuable year. I think I've gained immeasurably from the clinical experience of the staff people I've worked with, and just in the patients that I've had the opportunity to do some procedures that I hadn't done in dental school, and I've had the chance to really go ahead and undertake those procedures now and learn from mistakes before getting into the private practice sector where mistakes can be costly.
Thank you, Craig, for your thoughts on residency programs. Our guest has been Dr. Craig Spangler, who is completing the last few weeks of his year-long residency program. Join us for other programs in this series that are designed to provide you with ideas and information on how to plan and implement a successful dental practice.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.